Hi, hope you're well. Today I want to talk to you about managing pain. So the reason this is in the exam stress series of videos that I'm doing is because when we're working hard, when we concentrate a lot, when we're worrying, when we're anxious about exams or anything, it could be work related. If you're not a student and you're watching this, often we get aches and pains. Okay, specifically headaches, or it could be stomach troubles. And this is a simple technique to help you manage that pain. Now, if this is ongoing, persistent, chronic pain, you still need to seek medical advice. This is not a replacement for medication. But if this is a headache brought on by stress or anxiety, then this can absolutely help you, and we can get rid of headaches and things like that very, very quickly. So what I need you to do, get yourself comfortable, take a few deep breaths. Okay, so whatever condition we're working with here, say this is pain, I want you to bring to mind the pain. Okay, I'm going to ask you some questions about it, and I want you to play with it. Okay, and what we're going to do is we're going to change what we call the submodalities of the pain and effectively get rid of it. So what we're going to do is, first of all, think about the pain. Think about where you're feeling it. So if it's a headache, specifically where is it in your head? If it's a pain somewhere else, specifically, be as specific as you can, where is the pain? Okay, you got that? Good. Now, what shape is it? So, is it round? Is it jagged? Has it got soft edges? Has it got hard edges? Are there multiple shapes to it? Bring that to mind. Okay. Now, is there a colour to it? Is there a specific colour? Is it multicoloured? Is it black and white? There's no right or wrong answer, it's just how you represent it. So have a think about that. Okay? Good. So now I want you to think, are there any sounds that you associate with it? Can you hear any specific sound? Is it emanating from the object of the pain, or is it just around and about? Okay, good. So what we're going to do now is, however you represent that pain is perfect. That's absolutely fine. That's how you represent it. That's brilliant. What we're going to do now is we're going to change that and thereby just neutralize the pain. So, wherever it was, okay, wherever it was specifically, if it's a location in your head, if you remember the exact location of it, I just want you to take hold of it and move it. Mentally, just move it around. Okay, move it up, move it down, move it forwards, move it backwards. And as you do this, think about which position is giving you the most relief. Try moving it out way off in front of you. Try sending it way off behind. Find the position that you find most comfortable. It could be way off to the side. Okay? Good. When you've done that, when you've found the position that it's most comfortable in, now I want to think about the shape again. So whatever shape you picked, whether it was a smooth shape, jagged shape, simple shape, complicated shape, doesn't matter. Now, I need you to change the shape, play with the shape. So if it was hard-edged, round it off, smooth it off, or vice versa. Play with the shape, change it until you find some relief. Okay? Whatever colour it was, play with that. Okay? See what effect turning up the brightness of the colour does. See what effect taking the colour out of it has. Okay, whatever brings you the most relief here, often this is draining the colour right out of it. Okay, so we've played with the location, we've found the location that gives you the most relief. We've changed the shape to find relief. We've changed the colour to find relief. Okay, and now wherever the position of it is, whatever the colour is, whatever the shape is that makes you feel better, keep it there. And we're going to shrink it right down until it's pretty much out of sight in your mind's eye. Great, there we go. That should have effectively neutralised that pain. If you're in the middle of a study period, brilliant, you can get back on with it now. Again, if this is an ongoing chronic pain issue, seek medical advice. This is a coping strategy, a very effective one to minimise things like stress-related headaches. Okay, see you soon.